I just want to start with a little breathing exercise. One, because breathing is really important, and two, because it helps me be less nervous. So if this is available to you and you want to do a little breathing with us, then please do. You could find a comfortable seat, feet on the floor, grounding yourself. We're going to do a box breathing exercise. So you're going to breathe into a count of 4 through your nose, hold it for a count of 4, exhale through your mouth for a count of 4, hold again, and then inhale. So the visualization is this box, and you can do box breathing anytime you want to. You're getting anxious about something, do it. You can't go to sleep, do it. No reason at all, just because. Or your watch reminds you to do some breathing, you could do it this type. So if everyone's ready, you could, come on in, please. We're just going to do a breathing exercise. If you guys want to take a seat first. Yeah. And then. Hi. So as you're comfortably seated, I'm going to have you breathe in through your nose to a count of 4. 1, 2, 3, 4. Hold. 3, 2, 1. Exhale through your mouth. 1, 2, 3, 4. Hold. 3, 4. Inhale. 1, 2, 3, 4. Hold. 3, 2, 1. Exhale. 1, 2, 3, 4. Now do 4 more by yourself at your own pace. You're ready, come back into the space. Great, I hope you showed up today with presence and curiosity. This is my organization, Baja Cancer Outreach, and we really are trying to reduce deaths in Baja Sur, where our services are limited. And so my big $1 million picture is to reduce deaths by improving education, screening, and lifestyle for Mexicans who have very few resources. So you can scan that, or it's on the cards if you want to know more about the organization. So we're really going to talk about how eating plants affects your cancer risk. Are foods friend or foes? I'm going to tell you they're both. This is me again. So I am a medical physician. I don't practice medicine in California or Mexico. I'm retired from that. I'm really mostly a health educator, and I don't get any financial incentive to speak other than a few free cookies from Tracey. So I will work for cookies. So I don't represent any big industry, and I also cannot be your personal physician. So if you ask a question, keep it in the spirit of all people, what should we do, instead of personal advice. And nothing I say should be construed as personal advice. If you choose to follow a plant-based diet, I think it's worth talking to your doctor about it, but you don't need their permission to do it. But do watch medications, especially if you're on diabetic medication. You can reverse your diabetes really quickly with plant-based diet. So just be aware of that and talk to your physician, and find doctors who can talk to you about nutrition, which is difficult. Actually, talking about nutrition is not difficult. Finding a doctor who talks about nutrition is the difficult part. So let's all think about why you're here. What's your why? It helps me frame how I listen to a lecture. Why am I listening? And then I can pigeonhole everything into spaces that I can reference later. So think about why you're here. Is it because you are afraid of getting cancer? Is it because you have cancer? You have survived cancer? You're worried about recurrence of cancer? You have heart disease? You have diabetes or autoimmune disorder? Any reason that got you here to hear this lecture is you can frame whatever I say into that framework, because everything I talk about with cancer applies to chronic illness as well. So what's your why? My why is I want to add life to my years. You get to a certain point in your life, and And you know, you might live another 20 years, but I don't want to live that in the middle of Kaiser waiting room. I want to be vital, and I want to be able to do the things I want to do. So that's my why, and you might think about what your why is. And at the end, we're going to talk about SMART goals. So anything I talk about might trigger something in you that, wow, I'd really like to exercise more, or I want to eat more green vegetables, whatever it is. Maybe just put it in the back of your mind, because we're going to talk about a SMART goal at the very end. We're going to talk about risk factors you can change, things you can't change, toxins, alcohol and tobacco in particular, and again, friend or foe with foods. And then we're going to talk about whole plant-based eating. These are statistics very quickly. The top cancers for men in the United States, this comes from the American Cancer Society, are prostate, lung, colon, and bladder cancer. Number 5 comes in at melanoma. For women, breast, lung, colorectal, and uterine cancer, followed by melanoma. And the top killer for cancer is going to be lung cancer. And then breast and prostate are important, as well as our colorectal cancers for both sexes. 42% of all cancers and 45% of cancer deaths are attributable to modifiable risk factors. I'll stop. That's like half of cancers are affected by modifiable risk factors. And one survey showed that 78% of Americans did not know that lifestyle and diet affected their risk for cancer. That's astounding to me. And once you hear this, you can't forget this. It matters. It matters what you do every day to reduce your risk of cancer. The things that you can modify: diet, exercise, not drinking, not smoking, maintaining a healthy weight, and infections play a role. And some of those can be modified with vaccines. So, just said all this, that lifestyle plays a role in prevention, response to treatment, quality of life after cancer treatment, prevention of recurrences, and there's also a link between lifestyle and genetics. So you may have a family history of breast cancer, for instance, and what we say is genetics loads the gun and lifestyle pulls the trigger. So having a family history of any type of cancer or chronic illness does not define you. You have all the tools you need to reduce your risk. And that's really, really important to remember that. I hear people that get defeated. Oh, everyone in my family got breast cancer. I'm just going to die of breast cancer. It's not true. You can modify it. 300,000 women will be diagnosed with breast cancer in 2025, according to the American Cancer Society. Lung cancer is still the top killer for women in cancer risk, at least. And then number 3 was colorectal, and then 4 is melanoma. I put the little sun there because we live in Southern California. You do have to talk about it. You should use sun protective gear and sunscreen. Breast cancer can metastasize to the lung. Do you have a breakdown of how many women die from lung cancer? No, I don't know that statistic. That's what I was wondering as well. Yeah. So I'm going to stay on task. I apologize. I should have said, can you hold your questions? Because I will get off on a tangent and you will never hear this lecture. So that's my old brain, but I can't answer that question. But yes, breast does metastasize to brain and to lung. And once that horse is out of the barn, it's very difficult to reduce the deaths from that. So there are 4 million women surviving with breast cancer in the United States. Good news is that the death rate's been decreasing over time, and that's from treatments, not from changing the risk factors. We've done very little in convincing people that lifestyle matters. And then other good news is that the 5-year survival rate for lymph node negative cancer is still 99%. So it's not a death sentence when you get breast cancer, if you get breast cancer. Most important part of this talk is that heart disease is still the #1 killer of men and women in the United States and most Western countries. The things that I talk about today will modify your risk for chronic illness as well, including heart disease. So plant-based diets, regular exercise, limiting exposure to alcohol, and maintaining a healthy weight. Risk factors that you can't change: being female at birth, your risk is going to increase with age, and your family history. We talked about that. So only 5 to 10% of breast cancer is actually attributable to an inherited mutation like the BRCA, and there's some others that are inherited. But your genes matter, but what else you inherit from your family matters more. So if you come from a family that were bacon eaters, smokers, activity is not important, you inherited those patterns as well. And that's your biggest risk factor from your family, and the most easily modified as well. These are the stats for men. We already talked about it: prostate, lung, colorectal, and bladder. Colorectal is definitely food-related cancer, and bladder is increased with smoking. So both of those are lifestyle-related cancers. Statistics for prostate are very similar to the statistics for breast cancer, and that is a 1 in 8 lifetime risk for men, and 3 million men are living with prostate cancer. The research on prostate cancer and diet is a little bit more complex, and I don't know if that's because we haven't studied it as much, or if men are really complicated. That's hard to believe, but that might be the case. Sorry, that was a little big. So, but 3 studies I did pull up is that men who eat more fruits and vegetables had less fatal cancers, and the vegans in the Adventist Health Study had less prostate cancer, even compared to vegetarians. So that data was pretty clear. The other interesting study was that men who ate whole food, plant-based diets had a better quality of life once they were diagnosed with prostate cancer. So they had less erectile dysfunction, less bladder symptoms. So that's another reason to have a plant-based diet. Even if you hadn't done it before and you're diagnosed with prostate cancer, your survivability is better and your recovery is going to be better. This is stats on colorectal cancer. Very, very strong evidence that processed meats, red meats, alcohol, and being overweight increase your risk of colorectal cancer, and also good data that whole grains, fiber, physical activity, dairy products, and calcium may reduce your risk. I leave the dairy products up there. I'm a vegan, but I leave it up there for authenticity because the data did show that. Research in cancer or any research in medicine is difficult because there's so many confounding factors. And the dairy product one may be confounded by the fact that the biggest group of African Americans in the United States, the majority of them are lactose intolerant, so they don't drink milk. They are also a high-risk group for colorectal cancer. So it may be an outlying kind of effect, but not a cause. But I leave it up there. I don't want you to start drinking milk to prevent prostate cancer. There's lots of reasons not to drink dairy milk. Calcium supplements, that wasn't clear to me, but you don't have to take a calcium supplement to get enough calcium. These are the risk factors that you can change. The SAD Western diet, SAD is the standard American diet. You can change it: smoking, alcohol, exercise, maintaining healthy weight, exposure to environmental toxins. God knows we get exposed to lots of things in our air and our water, so maybe we can pay more attention to what we put on our skin or the cleaning products we use in our home. Those are modifiable for you. Poor sleep is a risk factor for cancer, so restorative sleep is important, and excessive stress increases cancer risk. So those are all pillars of lifestyle medicine that you could work on. Certain vaccines are preventing cervical cancer with the human papillomavirus vaccine, and hepatitis B vaccine will reduce liver cancer. So these are the pillars of lifestyle medicine. I fully embrace these. I wish all of you had a lifestyle medicine physician that would talk to you about this. We're going to talk about eating, but physical activity is important, managing your stress important, forming and maintaining loving relationships in a community. Events like this matter. Improving your sleep and avoiding risky substances. We still have to talk about it. People are still smoking. In my crowd, no one smokes, so I don't think about it, but it's still the #1 killer. Smoking is still a killer So we have to talk about it. Don't smoke. If you don't smoke, don't start. Yeah, you know all this. Alcohol. So how much alcohol is safe? 5 ounces of wine, 1.5 liquor, 12 ounces of beer. Moderate drinking, 1 drink in women, 2 drinks for men. What do you think? This is all a lot of propaganda around here. None. There is no safe amount of alcohol when you're talking about cancer risk. I'll stop. You've heard it. So if you drink, make it a choice at least. I know that this is going to increase my risk of cancer or the other things it does. It's a toxin. It increases the risk of cancer from the mouth to the anus, increases breast cancer risk, and liver, of course. Very briefly, I want you to drink water and eat grapes. Alcohol increases estrogen levels in men and women. So we've all seen men that drink a lot. They end up with boobs. It's because of the estrogen levels. So there's a visual for you. Men can get breast cancer, by the way. Alcohol is metabolized to acetaldehyde, which is a poison. It's a toxin. Every time you drink it, you're flooding yourself with acetaldehyde. It impairs your immune function, interferes with DNA repair, causes inflammation. But what about the blue zones? You hear that all the time? They drink red wine in Sardinia and they live to be 100. Yeah? So there's one research that showed that those wines were old vines, red wines, really high in resveratrol. So where's the resveratrol, which is the antioxidant? It's in the grape skins. So the redder the wine, the more maybe that it's in the water, the terroir of those wines. But that's not a reason to start drinking. And it's certainly, the ethanol in those wines is still a risk for cancer. So I'm going to tell you that most of that is marketing to tell you that drinking wine is going to reduce any risk for you. It doesn't. Alcohol is also bad for your blood pressure, your heart, and dementia and Alzheimer's. It's increased with drinking. I don't even need to talk about this. Don't do it. Sugary beverages, even Diet Cokes, artificial sweeteners are still suspect. Don't do it. Get moving. Consistent movement reduces all-cause mortality. Heart disease and cancer are in those. Reduces your risk of type 2 diabetes and may help you maintain your weight. It certainly helps with quality of life. This is how exercise reduces your cancer risk by reducing estrogen levels, improving immunity, lowering glucose and insulin levels, reducing inflammatory markers. Anything counts. Get moving. If you go from nothing to a 30-minute walk, that's where you get the best benefit. So start someplace and get going. You don't have to be a runner. You don't have to do it vigorously, but you could. But just getting out for 30 minutes a day is going to reduce your all-cause mortality. This may be something to set a SMART goal around. It's exercise. So this is my attempt at AI. This is a giant cheeseburger running down these athletes. I know, I love it too. I made it and it was hilarious. So you cannot outrun a bad diet. Athletes will sometimes think that they can, but it'll catch up to them. But you can take steps towards this giant salad. I don't know why she's out in the woods with this flowy dress, ready for the prom, but she's in love with those vegetables. So junk food, have to talk about it. How many people in here identify as vegan? Yeah? See? Vegetarians? People who love fruits and vegetables? The rest of you, I hope? Good. So junk food it's pervasive. I read one study that 70% of American diet is junk food, ultra-processed foods. Like, wrap your head around that. People are not even eating real food. So even if you're a vegan, you need to think about the food that you're eating. You know junk food when you see it. It does all of these things, causes free radicals, inflammation, helps with angiogenesis. Angiogenesis in the face of cancer is bad. That's bringing in new blood vessels. And we just talked about metastasis, and that's how cancers are able to metastasize, is by bringing in new blood flow, so angiogenesis. These foods can cause actual damage to the cells. They obviously cause diabetes and weight gain. Junk food, vegan junk food, you know it when you see it. If you're making a choice about a vegan dessert that's full of coconut oil and sugar, that wasn't a health choice. I mean, at least own it. It wasn't. It's not a good choice. You could have had the same piece of cake with eggs and dairy in it for the same risk to you. So don't do it. You know this stuff. Ultra processed foods, if it comes in a box or bag and someone has to tell you what you're eating, it's ultra processed. There are minimally processed foods, which are very convenient, useful, and good for you. Like Tracey's Real Foods. If you look at her labels, it has real food, minimal or no oils, and the fiber's all there, everything that you need. So I'm not down on all processed foods. We use them in our house. Canned beans are processed, but you wash a can of those, throw them on a salad, you've got a fast meal. So I'm not down on all processed food, just the ultra processed foods that you don't know what they are. They're usually high in seed oils or saturated fats, and they're sugary usually. So big list of scary chemicals, but these are the chemicals that are in foods that are your friends, and they have drug-like reactions. In fact, some drugs that we use came from plants. I'm not saying to take these as supplements. I'm telling you to take them and eat them as foods. Big list of them. So my favorite is epigallocatechin gallate. Did you get that? That is in berries and green tea. The other word for that is EGCG. You don't have to learn the big words. Sulforaphane is in broccoli, kale, and cabbage. Anything that came from the cabbage family has sulforaphane. Interesting that if you're going to cook these cruciferous vegetables, chew a few of them raw or include raw plus cooked, because the raw, you get, I think it's myrcene out of the raw vegetable that helps you get the sulforaphane out of the cooked vegetable. You don't have to worry about all these things. It's just, if you think about it like, oh yeah, I'm making broccoli, I think I'll have a raw piece and then I'm going to eat it cooked. Don't make yourself crazy over these things. Anthocyanins are going to be in your reds and purples. Polyphenols are high in cruciferous vegetables. Flavonoids are going to be in all of the colorful plants. We talked about resveratrol. It's an antioxidant, and it's in red grapes. Also, cherries, cranberries have it as well. Lignans, really interesting. Flaxseed produces lignans, and lignans absolutely reduce your risk of breast cancer. They did a study where they had a placebo muffin and a muffin that was made with like a tablespoon of flaxseed, and they gave it to cancer patients. And over a 2-week period, they were testing their blood. And the women that had a tablespoon of flaxseed every day, they dripped their blood onto a petri dish with breast cancer stem cells, and their blood was able to fight those cancer cells. The control group, they dripped that on the cells, and the cells were able to divide and keep growing. So that's huge. There's flaxseed in my oatmeal every time I eat it. The isoflavonoids, you're going to find those in soybeans, which we have another slide on that, but soybeans are good. Don't give up soy. If you have breast cancer, it's going to reduce your risk. Same players. We keep seeing the same foods over and over and over again. These ones in particular are anti-estrogenic. We want to tie up the circulating estrogen and block the receptors, and that's what these foods will do. That's why soy is up there as number one. It blocks the exogenous estrogen, so it definitely does not increase your risk of cancer. The myth about soy will never die. I learned it in medical school. Never let a breast cancer patient eat soy. That was a study on mice. In humans, the studies have been very good across many ethnic groups, that it reduces your risk of cancer and increases survivability. There's a scan code, and I have it in my phone probably, but this was what we did last weekend. We talked about Let's Beat Breast Cancer in association with the Physicians for Responsible Medicine. And we have flyers over here. So you could take one of those, and the tenets of lifestyle medicine that will reduce breast cancer risk are there. So you can get a lot more information about breast in particular. Okay, I'm not going to do all these. Tracey told me not to geek out. So these are all the pathways to cancer. All this stuff has to be going on for you to get cancer cells growing, right? So the way that I look at this is, if if my body is always fighting cancer, which it is, and I send the guards over here, I'm distracted by the cheeseburger and the bad bacteria in my gut, and this is all going on over here. What's happening over here? The cancer is doing all of these things. It loves chaos. It's bringing in new blood vessels. It's doing more DNA damage. It's sitting there doubling and tripling and quadrupling all the time while your body's doing other work. So one way to look at eating more plants is it's like putting your seatbelt on, right? You put a seatbelt on, there's no guarantee that you're not going to get in a crash, no guarantee that you're not going to die in a crash. But I feel better with the seatbelt on. So think about plants as your seatbelt to prevent some of these chronic illnesses. This is a schematic of how that might work in your body. So oxidative stress, it has to happen. It's happening all the time in our bodies, but the things that increase oxidative stress are going to be grilled meats, processed meats, bacon, pepperoni, corned beef, deli meats. All of those are class 1 carcinogens. And they are carcinogens because they bring in oxidative stress and free radicals. So if we have a big bunch of these circulating good chemicals from the berries, greens, green tea, soy, then we're better able to balance that away from the oxidative stress, so less damage is done in the body. Angiogenesis, I talked about that. It's really important for a few cells to become a tumor. They need a blood supply. The same things I just talked about are going to increase the availability of blood vessels, everything I just talked about. And here are your fighters again. We need healing and repair, regenerative systems to heal any damage that's there and help us recover from cancers and to help us recover from chemotherapy and help us recover from radiation. So these are the good players. Green tea, purple sweet potatoes. We had those last night. They were delicious, actually. Berries, tree nuts, walnuts, and flaxseed. And here's our cleanup crew, same ones. Mushrooms, really interesting. Very few mushrooms in people's diets will reduce their risk of breast cancer. Garlic, ginger, turmeric, all of those are good spices to throw into your food. Chili peppers are good for reducing or improving your immunity. The gut microbiome, so important for every process in your body. When we eat enough fiber, we select out good bacteria, and then the good bacteria helps by releasing good chemicals that reduce inflammation and oxidation. So all plants have some fiber. Meat has no fiber. I'll stop. Meat has no fiber. So if somebody tells you a carnivore diet or a keto diet or all meat all the time diet is good for you, you need to think about your gut microbiome. You're not feeding it the good bacteria anything they can live on. So I don't know how those people actually poop either, but they're also increasing the risk of stress and reducing immunity. So all plants have fiber, and you want a variety of them. The fermented foods are good to bring in good bacteria. Non-dairy yogurts, look at the label. Some of them are junky. Most of them are junky, especially anything with coconut cream. They taste delicious, but they're bad. They have a ton of saturated fat, and they usually have a lot of sugar. Silk makes a soy yogurt that's really quite delicious and low in sugar. Miso and kimchi and sauerkrauts that have been fermented are good as well. Take-home messages, another AI. I told it, the clue was, show me an image of a donut holding an angry donut holding a stop sign, holding back the bacon, cheese, and grilled meats. And this is what you get. I know. Another fascinating one. Take-home messages. Processed meats are bad. This is the anti-bacon lecture. They're class 1 carcinogens according to WHO, the World Health Organization. So don't do it. If you take nothing else away from here, please never eat a piece of bacon again, or a deli meat, or a corned beef. And that one hurts because I'm Irish. I love corned beef. Used to love it. Don't love it anymore. All the red meats are class 2 carcinogens, but all meats with heme iron are suspect. If you heat up a chicken breast or get a good grill on salmon, you're still getting free radicals, so they're not good for you. Dairy, talked about that. Dairy comes from a lactating mammal. What do we need to lactate? Estrogen. So she has already circulating estrogens that allows her to lactate before the farmer gives her a bunch of other stuff, like other hormones, antibiotics, everything else you find in milk. So you don't need that, especially if you're trying to reduce your risk of prostate and breast cancer. Cheese, of course, is highly concentrated milk. So everything that's bad with dairy milk is concentrated in cheese, and then you add in a bunch of sodium as well. So yeah, cheese should not be on your plate. I'm going to include vegan cheeses. They're not good for you either. They're full of saturated fat and salt as well. Alcohol is carcinogen. These are the happy foods. I love all of these foods. It's a take-home message. If you can incorporate any or all of these superfoods in your day, you're going to be ahead of the game. So putting it all together, vegetarians have less risk of all cancers and cardiovascular disease and diabetes. Vegans did better than the vegetarians that continue to eat dairy and eggs. We talked about which cancers are clearly associated with diet, but that colorectal, prostate, breast, and stomach cancer. Myeloproliferative cancers are the blood-borne cancers, and they are increased with people that they're decreasing people that eat a vegetarian diet. And the other thing they found is that the vegetarian or vegan diets did not increase any risk of cancer. So contrast that to what I just said about the keto and the carnivore diets that are all circulating with influencers right now, is they actually cause cancer. So when I tell you to eat a plant-based diet, at least I'm not saying eat a bunch of carcinogens. That was a rant, by the way. What's in a whole food plant-based diet? You're going to include fruits and vegetables for obvious reasons. The legumes, soybeans, lentils, peas, all the beans are legumes. They're high in protein and in carbohydrate. Really good for you, plus they're very satisfying. Whole grains, anything that still looks like a grain. So rolled oats count, barley, brown rice is good. We include quinoa in grains, millet, even though they're seeds. They're a good source of fiber. All the nuts and seeds are good for you, but if you're trying to lose weight, go easy on nuts and seeds. All the herbs and spices are fair game. Put them in everything, including your desserts or fruit drinks. And we're going to say to eliminate all animal products and seed oils and excessive oils. Vegan versus whole food plant-based. Vegan is a lifestyle. Whole food plant-based is a diet specific. You can be a junk food vegan, and a highly refined vegan diet is worse than sad. Meaning, when they put junk food vegan diet up against the average American diet, the people that had an average American diet were healthier than the junk food vegans. The vegan diet is still good for the planet, still good for animal cruelty. I mean, all the things, but if we're doing head to head and you want to be healthy, being a vegan is no insurance that you're healthy. Yeah, I'll find it for you. These are common myths about plant-based diets. I won't get enough protein, calcium, iron, nutrition. Not true. It's too many carbohydrates. I hear that one all the time. Well, if you're eating whole grains and fruits, yeah, you're getting carbohydrate because all plants have carbohydrate in them. So it is a higher carbohydrate diet. But when you look at all healthy diets across all research, they all want to get you off the garbage, which is the garbage, refined carbohydrates, and that's where your ultra-processed foods are. Plant-based diets will make my diabetes worse. Not true. They have shown reversal of diabetes with plant-based diets. I need meat and dairy for protein. Also not true. You can get it from all plants have protein, and the best sources for us who are vegan are the legumes, which includes soy products, tofu, tempeh, natto. It's expensive, boring, extreme. None of that is true. I think extreme is having your leg removed because you have diabetes, or having an open heart surgery because of the saturated fats and high cholesterols. Those are extreme. Eating a vegan diet is not extreme. It's sometimes inconvenient. Truthfully, it's inconvenient, but it's not extreme. And vegans think they're invincible. You heard that one? Well, you're not. That's the seatbelt analogy. We're going to die just like everyone else. It's what you do between the birth and the death that matters. And you can have a profound influence on your environment and the people around you and everything else by eating a plant-based diet. So you're not invincible, and some of us will get cancer, and some of us will get heart disease, and all of us will die. Garbage, we talked about that. I'm beating a drum there. Where will I get my protein from? I talked about legumes, whole grains, nuts, and seeds. All plants have protein. If you eat a variety of whole foods and you are able to maintain a healthy weight, then you're getting enough protein. There's some data that older folks needed more protein. I go back and forth on that, but I think what happens with the elderly in particular is their diet deteriorates, so they're only eating garbage and they don't get enough protein and nutrition to maintain their weight, and therefore they're not getting enough protein in that situation. But what we really need to do is convince them to eat a robust diet with all the fruits and vegetables and protein. Strength training is your most important way to prevent sarcopenia or muscle loss over and above protein intake. I get 70, 80 grams of protein. I don't even try every day. We're going to limit fats. They're inflammatory. They cause weight gain, diabetes, and heart disease. Tracey would be the first one to tell you that you can make food without oils. You can saute with water or broth. And avoid the hidden fats. When Tom and I quit adding oil to sautés and stir fries, we didn't even notice. We literally did not notice a taste difference. So get them out and start right there. Get rid of them, because you're probably not even tasting them. And then there's a lot of hidden fat in the junk foods as well. If you go out to eat, you're getting a lot of fats. Diabetes, another scan code for Physicians for Responsible Medicine. They have really, really great resources for plant-based diets. But you brought one? Great. Oh, one of their handouts on diabetes? Perfect, perfect. So grab one of those. We all want to reduce our risk of diabetes. Diabetes is really a disorder of too much fat in your cells. It's not a carbohydrate problem, it's a fat problem. And that is not just fat on your body, but fat in your cells. The cell has too much energy in it, so it closes the doors to glucose, because the fat can come in the back door and fill up the cell. So there's plenty of energy in case you're going to starve to death. You have plenty of that. But then it shuts the door. So the insulin comes and knocks on the door. It's like, hey, I got a bunch of glucose. This person just ate cake. Let me in. No, full up. I don't need any more energy. So what happens? The glucose keeps circulating. The insulin levels get higher and higher to try to force the sugar into the cell. That's what diabetes is. It wasn't the carbohydrates that caused it. It was the fat that closed the door on you. Getting started. What are we doing? How much time do you need?
Well, let's lay down, we're gonna wrap it up.
Okay, we're wrapping.
All this, and you have to be out of your mind.
Yep. Get started, do some planning, buy things in advance, don't make last minute decisions. That's going to help. You could set a SMART goal around getting started on a plant-based diet and start someplace. I'd like to see you try to get 30 different vegetables and fruits and spices in a week. It's a fun game. Tom and I play this. We got 16 the other day with lunch and dinner. Try to get organic if you can. I'm going to skip the rant about meat substitutes, but compared to what? The meat substitutes are still better than beef. Sample menu, vitamins. Oh, really important. If you stop eating all meat and dairy, you need to take a B12 supplement, 500 to 1,000 milligrams a day. That's a non-starter. And everyone over 50 is probably B12 deficient. Talk to your doc, have it checked, or start a B12 supplement. Omega-3, vitamin D are important as well. We take those. Don't take supplements to treat disease. Use them where you're deficient, and natural does not mean it's safe. I gave you a little handout of two things. One is to some of these micro habits that might appeal to some of you, and the other is how to set a SMART goal. Should be specific, measurable, attainable, relevant, and time bound. So mine this last week, we went on a vegan cruise, and I wanted to make a change. So I thought we were eating too few green vegetables and berries, and so this was mine. I will buy and wash organic fruits and veg on Monday. I will eat a beet, berry, and kale smoothie every day in October before I work out. And the reason I'm doing it is I want to add more antioxidants to my diet, and it will help with my endurance and recovery for my workouts. And then I'm going to see how I feel about that on November 1st. So it's specific, measurable, relevant to me, and certainly obtainable. So please take a minute to, after Tracey talks, to write out what that SMART goal might be, and I'll be around to answer questions, or I can help you with the SMART goal. And here we are. Thank you so much to Plant Diego. That's my email address. If you want to know more about the nonprofit, again, I don't practice medicine, but if you have a burning question I don't get to, you could shoot me off an email, and I think my email is on there as well. Maybe from you, yeah.
One question is that on your screen you said, how do you process foods, even vegan foods, increase IGF-1?
Mm-hmm.
One, is that true, and how is that possible? And number two question is, Dr. Neil Barnard said that chicken is really like one of the worst things, second to the processed meats for cancer. And I wanted to know why that is.
I have not heard him speak about that, although I follow his thing, so I don't want to put words in his mouth. But all the meats have heme iron in them, including chicken and fish. And so when they're superheated, it releases free radicals. And then chicken is full of antibiotics. And what do they tell you if you're using chicken in your kitchen? Bleach everything. It's because they're full of bacteria. It's disgusting, you know? We don't have to do that at home with two different kinds of vegetables. I cut up things on the same boards except for onions and fruit. And your other question was about the IGF-1. IGF-1 can be elevated with saturated fat and other fats. And so junk food that's where the coconut oil sneaks in with saturated fats. So I think that's the connection. But yeah, that's a good question. Thanks.